In Health News tonight, living with epilepsy and the latest treatment available.
Epilepsy affects about 60,000 people right here in Connecticut. News 8's medical reporter Jocelyn Memento live in our New Haven newsroom tonight with how a 21-year-old woman overcame her diagnosis and what doctors did to help her. Jocelyn.
And Darren, epilepsy is a seizure disorder caused by a head injury or, in the case of people like Tori Mordosky, are born with it. There is no cure, but people like Tori are determined not to allow epilepsy define who they are. Tori Mordosky was 5 years old when she was diagnosed with epilepsy.
They noticed that I was coloring and then I'd stop. And then I'd start coloring again and stop.
The challenges?
I was having 300 seizures a day.
Difficult.
Homework that would take the average sixth grader half an hour to do took me 3 hours.
Can I have you walk in a straight line?
Now 21 years old, a confident Tori will soon graduate from college with honors and is no longer blacking out, thanks to medication.
It took me 12 years to find a regimen that worked for me.
Can I have you open and close your hands?
She checks in with neurologist Dr. Schuyler at Hartford Hospital once every 6 months here at the state-of-the-art Epilepsy Center, where patients are diagnosed using the latest technology.
In somebody who has epilepsy, there's something about their brain, either some type of lesion, some sort of predisposition that they inherited, that makes their brain more likely to have seizures.
There is no cure, but patients like Tori have a newer class of drugs available, better tolerated and requiring less monitoring.
We can get about 2/3 of patient seizures under good control with the medications alone. That's really the goal of treatment, is to be at that point where you're seizure-free and on a medication therapy that's not affecting the quality of life.
Tori sees life ahead, bright-eyed and ready to face what obstacles are thrown her way.
You know, I'm passing these people and I'm saying to myself, well, this might be shallow of me to say, but you're probably not on 3,000 milligrams of drugs right now. And I think I'm going to beat you in this race.
She's great. Earlier this year, the FDA approved a new drug to better manage certain seizures for patients who do not respond to medication. Surgery and a non-drug treatment using a pacemaker device are other options. This Saturday in West Haven, you can ride, run, or walk, benefiting the Epilepsy Foundation of Connecticut. For more information, log on to our website.